I like to think I'm fairly laid back. I don't like to be too authoritarian in the way I consult patients. I think every woman has the right to choose what they want to do. My job is more to guide people, I think, to ensure that the right thing's being done and things are being done safely, but to give the patient the autonomy to make most of the decisions themselves, because most things there are options about what you can do. So I like to think that I'm fairly laid back. I like to think that I'm fairly consultatory in what I say to people, give them the option to make decisions, as I've said. I like to think I'm friendly and caring as well. I hope people walk out here thinking, yeah, he listened to me, he answered my questions, and you know, he took me seriously. I also like to try and be on time as well, which I think is a very underrated skill. Some days are better than others, of course, but that's something I also try to aspire to be. When I was a second year resident, I had no job to go to, and someone got sick, and I got put into a 6-month obstetric job, just because there was no one else to do it. And I did it and seemed to pick up a lot of the basic skills pretty fast, seemed to have a bit of a knack for it, and the specialist I worked with said, you should do some more of this, and kind of rolled on from there basically. So just sort of found me, really, rather than me finding it. Living close is a big plus for me. I don't have to be in the car, you know, 20 minutes each way sort of thing, adding into the time. But once again, very understanding wife, very understanding children, very supportive as well. They understand how it is, and you know, my girls, especially my daughters now, they don't turn a hair when I have to go. So see you later, Dad, we'll see you when you're back. So no, it works out quite well from that point of view. It can be hard until you see the person. I think, gender plays a part. There are women who would feel more comfortable with a female provider. That's entirely understandable. There may be people who prefer someone younger, perhaps prefer someone older, so that comes into the situation as well. I guess the hospital they work at will be a factor as well. So certainly friends and family, I find, are very good advice givers with regards to obstetricians, because they may have had people, you know, someone look after them who they liked, and I think word of mouth, at least for me, has been well and truly the best marketing tool you could ever ask for. Most patients come to me because of word of mouth now.